Okay, back after short pause. Sorry about that. Another phone call. Let's begin. So we were on the percent rural variable, so we're back to that now. I just described what it was. Again, Census Bureau designated 2,500 residents or less as rural. Yeah. Um, and there's three designations: suburban, urban, or rural. It's based off that 2,500 marker for rural. And here we have the histogram. I make a histogram for this variable as well. A little less detailed than the previous ones. I have the bin count at 56. And I limit the plot to 100 because it's a percentage. So actually 0 to 100. Don't really have to limit it there. I included that for some reason. Anyways, what I can say about the histogram, looking at it, it's showing the distribution of rurality rates among counties. And it seems to be relatively uniform, except at 0 and 100. There's a significant amount of counties that are closer to 100% rural, according to the figure. And a good proportion of counties are also 0% rural, which is why the bar height at 0 is distinguishably increased in comparison to the other uniform values as well. But due to the spikes at 100%, it would be safe to assume that the histogram for this variable uh, is unimodal, we can say. Just important statistical term to add in there. And one thing I added, which I don't have on the slide there, was a histogram, as I said, for the rate of suburban, urban amongst U.S. counties, just to play with the data a little bit. And that would just look like the complement of the percent rural. So you would take the data labeled percent suburban or urban and do 100 minus data column. We have the list column where we cut out data percent rural. I want to be able to quickly share this. So I'm going to show it here. Here we are. Right there, I made the inverse, which is 100 minus the data percent rural. Percent rural, we're cutting out that column. And that would give us the percent of suburban or urban. And that uh, looks like this, just the exact opposite of what we had for our rural. See, wait a second. There we are. The exact opposite. The peak, the unimodal peak is on the opposite side. It's on 0 instead of 100. But yeah, a very significant portion of U.S. counties are 100% rural. 100% of the Census Bureau designated areas have 2,500 people or less. It's revealing. And well, this slide is basically going into detail a little bit about that. Actually, it's just giving a rough summary of the ideas I spoke about. 100% rural, significant proportion, 0% rural. Yeah, there's a bit of a peak there as well. It certainly distinguishes itself from the rest of the very uniform distribution between 0 and 100. So you could say that there, well, counties sometimes are entirely cities, or a city might have multiple counties. Anyways, I'm moving on to the response variable now. The one, our y variable. We have all our x variables listed out. We don't have a y variable, so we need to talk about a y variable, the percent poor or fair health. So I got into some detail about this earlier. I was speaking about it, and I was saying that it's a measure of percentage of residents within a county that self-reported poor or fair health when asked in a survey, where the possible responses were excellent, very good, good, fair, or poor. So fair or poor at the bottom two. If you say fair or poor, it's bad. You're not sure of your health. All right, so I feel that this is a good variable to start with when trying to measure community health because it's very general. So I'm trying to say that it's not focused on, for instance, diabetes rates or pregnancy, teen pregnancy rates or asthma rates. It's general and it puts to the people how they view their own health. It makes no distinction between physical and mental health differences as well. So that adds to the generality. So starting with this variable paints a general picture of which areas believe they are healthy, which areas believe they are less healthy. And since the values are self-reported, collecting data for this variable was easier as a smaller sample sufficed. And this is reflected by the fact that there are no missing values for this variable as well, which makes it easier to utilize when trying to measure correlation with my explanatory variables. So, um, allergies. So here we are. We have the histogram here. Bin count 56, a little less detailed than the first two explanatory variables. And well, it's actually very detailed because there are few missing values. People are self-reporting, so it's easier that way. And what I can say about the histogram is it appears to be very close to normal, very close to a normal distribution, which a slight right skew. So the proportion of people reporting poor health among U.S. counties is relatively normal and centered around a median of a little less than 20%. Okay. And had no missing values, which made it more reliable for the correlation analysis. And the median just under 20%. So in this next slide, I'm going to correlate physician rates and percent reporting poor health. Let me dive into this a little bit more. So I use the dot scatter, plot dot scatter function on my subsets. I have two subsets here consisting of the column for primary care physician rate and the column for percent fair or poor health. The way that they're ordered indicates where is my X and where is my Y. The first one is X, so I put the explanatory variable first. Titled the plot and um, the data that I'm taking is from the data equal to subset, which I've titled earlier in the code. And here we have the, well, sns.regplot is the function that allows me to create a line of best fit. And the line of best fit seems to be a little bit downward sloping, so there seems to be a negative correlation between our two variables. And all the dots represent counties, actually, people per physician. If we take any given dot, we can see, 20, a county with having 20 people per physician. That county has a percentage of the percentage of people saying they have poor health more than 40%. Uh, yeah, just a second. Anyways, today is a bad allergy day. I have to pause frequently because I don't want to blow my nose on camera, but I'm fine. I'm completely fine. So let's get back into this. Let's talk about, well, I've spoken about what's going on with the scatter plot. Bit of a negative trend, downward sloping. So we're kind of being told that when you have more people per physician, the percentage of people reporting poor or fair health falls. So actually, uh, when there's less people per physician, we're being told that people have more access to physicians. More access to physicians is correlating to more people saying they have poor health. Okay, So that could just be a matter of, well, now you know you have health problems. People maybe are optimistic when they don't know anything from a doctor. They don't assume the worst. But when they're going to a doctor regularly, well, they could get health anxiety. They could know more about some of their issues, even issues that are, not that big of a deal. So again, I don't know to read too much into the people per physician variable, but it is interesting to use, and I use it again in a more colorful sketch here. This data here is interesting because I take the same x-axis, y-axis plot, but now in the red I plotted the 10 densest counties in the US, and the blue dots are the 10 least dense. Okay, we can go to the next slide. Just quickly look at some of the code here. So from the small subset, I took the dot head, the 10 um, smallest, and well, by the way, I sorted the data initially in an ascending order from the population density per square mile. Then the tail and head are me taking from the tail, 10 or 11 biggest, from the head, 10 or 11 smallest. That's what dot head and dot tail are telling me. I use the scatter plot function as usual, but I include the bubble plot here. And what we can see, well, it's hard to read too much into this, but the first thing I see is close to zero people per physician. We have a almost vertical line of some of the least dense counties. So when it comes to the least dense counties, there doesn't seem to be a correlation between access to physicians and how people are scoring their health. Well, we have the furthest out least dense county at 250 people per physician, which means, wow, like not a lot of access. They believe their health to be poorer than the majority of the other least dense counties. But really, there doesn't seem to be a trend. Where there's more of a trend is for the most dense counties, a downward sloping trend again. And what seems to be going on is these dense counties, as they get less access to physicians, so more people per physician, well, the percentage of them saying they have poor health actually falls. So that actually supports what we found here in this scatter plot, right? Less access to physicians. Well, less people reporting that they have poor health. Okay, interesting. And we looked at this slide again. It's a complicated bit of code that would take some time to explain. I do believe I've explained the top half. Um, and the latter half, I will explain in a second video because, well, this is going to take quite a few videos to get through and some time. But let me just conclude with our first part of this analysis. What I see, denser counties generally have more people per physician. Almost pretty much no doubt about that. Health outcomes differ. Densest county, uh, the densest county is, 15% of people are ranking themselves as poor or fair health. From the least dense county, you have 23% of people ranking themselves as poor or fair health. So over half of the least dense counties have greater than 20% of people ranking themselves as poor or fair health. And only three of the most dense counties have greater than 20% saying likewise to the people from the least dense county. So something to read into there. Okay. You know, denser counties have more physicians, yes. But here we're also seeing that when you look at it more broadly and you zoom out a little bit, less dense counties are purporting poor health. because and denser counties, well, only 20% of them, only three of them said they have 20% or more. Um, from the three densest counties, okay, well, only three of the most dense counties had 20% greater than, yeah. So from the most dense counties, only three of them had a proportion of people reporting that 20% or more had poor health. Okay. Yeah, a bit of that's a tongue twister. Anyways, just some more about the people per position explanatory variable, some of the ratios there. And here the bubble chart comparing 10 most, 10 least dense counties. The size of the bubble is based on population density, our population density variable taken from the original data set. And we colored them red and blue, which I put here in the code. Uh, Actually, the code on the line underneath hashtag bubble plot extends further to the right. And further to the right, you'd be able to see where I use the coloring function. That's not available in the screenshot here. But yeah, thanks for listening. But you know what? Before I say thanks for listening, I want to take a second to show the full extent of what was going on here. Where's this? Okay, here. So we can see the coloring, blue coloring, red, um, and we have labeled the large subset, the one for the more dense counties. And yeah, thank you for listening. There will be another video to continue.